Okay, today we're talking about Chapter 4, Health of the Individual, Family, and Community. Your objectives for this chapter: each level of Maslow's hierarchy of basic human needs, explaining nursing care necessary to meet the needs in each level of Maslow's hierarchy, discussing family concepts, including the family roles, structures, functions, developmental stages, tasks, and health risk factors, being able to identify aspects of the community that affect the individual and family health, describing nursing interventions to promote, maintain health of the individual as a member of a family and as a member of a community. We as people are complex. We are influenced by and we respond to our internal and external environment. Our behaviors, our feelings about ourselves and others, our values, and the priorities we set for ourselves all relate to how we meet our physiological and psychosocial needs. These needs are common to everyone, and we must meet them. They're essential for the health and well being of all people, and they're called the basic human needs. Basic human needs can be met or unmet in several different ways. A person can meet some needs independently, but most of these needs require some sort of relationship or interaction with other people in order for us to partially or completely fulfill them. When we satisfy our needs, it can depend on the physical and social environment, especially our family and our community. Holistic nursing care is based on considering the fact that all human dimensions, including how the patient's basic human needs are met and unmet in health and illness, occurs. This helps the nurse provide person-centered care. And this chapter will discuss how basic human needs, the family, and the community all affect the health of each individual. In nursing, we have to think about the physical safety, psychosocial, and spiritual needs of each person. And Maslow helped to develop this hierarchy of basic human needs that helps that or allows us to do that or guides us in a direction that we can do that. The certain needs are more basic and essential than others, and they must be at least minimally met before other needs can even be considered. A nurse in a wellness center is presenting a class on integrating holistic therapies with traditional healthcare. The nurse talks about the trend in healthcare to treat each client in a manner that reconnects the total being, which would be considered a holistic approach to health, physical, emotional, and spiritual well being, emotional and sexual contact, a healthy work environment, or financial success and post secondary education. And spiritual well being, you're correct. A holistic approach to health helps us to reconnect our mind, our body, and our spirits. And that total connection has to be understood whenever we provide health care. Although other options listed here might contribute to a total or holistic perception, they would not be the best answer when we're talking about holistic care. I wanted us to consider the physical safety, the psychosocial, and the spiritual needs of every patient. So he developed this hierarchy of basic needs, and that describes what each person needs, and it lists the most important at any given time. Certain needs are more basic or essential than others, and they have to be minimally met before others can be considered. Um, there was a certain set of criteria that Maslow also required in order for us to do that. Heuristics for Maslow are whenever something is considered a basic need, its lack thereof, okay, would result in someone becoming ill. So, in other words, if I didn't eat a proper diet or proper nutrition, failure to do so, okay, like in somebody who has anorexia, would cause me to become ill. The fulfillment of doing so would help me to prevent illness or to signal that I'm in good health. Okay, so by meeting this need, it's either put me in a status of good health or it's helped me to prevent some sort of illness. Okay, fulfillment of the basic need would take priority over other satisfactions when it's unmet. So if I didn't meet it before I could meet higher levels, I would need to go back and meet this basic need. Okay, that's what's going to help stabilize me, get me back to feeling right so that I can meet the other needs. A person feels something is missed if the need is not met, and a person would feel satisfaction when the need was met. Table for the hierarchy of needs according to Maslow. We start at the very bottom with the most important, which is physiologic, then safety and security, then love and belonging, then self-esteem, and then self-actualization. And this is on page 66 in your book. Of a toddler with the phone number for the Poison Control Center. Which level of Maslow's hierarchy of needs is the nurse addressing? Physiological needs, self-actualization needs, love and belonging needs, safety and security needs. Needs, you were correct. The mom is meeting the safety needs for providing the mother with the phone number. She needs to call there and get information on how to address something that the toddler may have consumed that might be dangerous. She's going to want to call that poison control number. The physiological needs include oxygen, food, rest, and elimination. Love and belonging involves relationships with others, and self-actualization is reaching the highest level or potential that we can as a person by developing our own unique capabilities. Focuses attention on the strengths and abilities of the patient rather than their problem is helping them to achieve which of Maslow's basic human needs? Self-actualization, self-esteem, love and belonging, safety and security, or physiologic. Actualization, you were correct. To meet the patient's self-actualization needs, the nurse would provide a sense of direction, hope, and maximize that patient's potential. Self-esteem is met by respecting patient values and beliefs and providing attainable goals for them. Love and belonging needs are met by including family and friends and establishing caring relationships. Safety and security needs are met by encouraging spiritual practices and independent decision making, and physiological needs are met by those things that are met to maintain life. So that's rest, elimination, oxygen, food, water, those kind of things. Okay, physiological needs have to be met at least minimally to maintain life, and they're the most basic in the hierarchy of needs and the most essential to human life. Therefore, they have the highest priority. Oxygen being number one, followed by food, water, elimination, temperature, sexuality, physical activity, and rest. You already should know that oxygen is most essential because all the cells in the body require it for survival. Oxygenation is carried out primarily by the respiratory and cardiovascular system. So any change or structure or function of one of those systems can cause an increased need for oxygen. This could be acute, like in CPR, or it could be chronic, requiring things like special positioning, treatments, or teaching. So we evaluate that patient's oxygen needs by assessing things like the color of their skin, their vital signs, their level of anxiety, how they respond to certain activities, certain levels of restlessness or mental responsiveness or dullness. Food, water, and elimination. So we have to have a balance between these things. We take stuff in, we have to be able to put it back out. So if we're healthy, we drink fluids to satisfy our thirst. Okay, our body drives this through homeostasis, and it helps us to maintain our fluid balance when the body is in a normal state of function. When it's not in a normal state of function, then it may result in something like dehydration or edema. Okay, so dehydration could come from something like severe diarrhea or vomiting, and edema can be caused by things like kidney failure, congestive heart failure, trauma, burns, stuff like that. Injuries. Okay, so we may have to measure the eye nose. We may have to test, how much elasticity is in the skin. We have to check the skin and the mucous membranes, and we have to weigh the patient. And we're all looking at this to determine, what the fluid balance is in the patient. Then foods and elimination, they're related to physiological needs. We have to balance those foods through both the digestive and metabolic processes. Our body, triggers a response in the brain called hunger. Okay, you guys know about that, right? Or we're hungry or we're hangry. Okay, and if we don't have enough nutrition, all right, then it's going to result in either a nutrient or an electrolyte imbalance and possibly weight loss. Okay, so waste products themselves are eliminated through the body, um, through the skin, the lungs, the kidneys, and the intestines. The nutritional status is assessed with different indicators, including weight, muscle mass, strength, and lab values. We look at the body to determine what the body temperature is. Okay, now we have a narrow range of body temperature, so we really want the body temperature to be around 98.6. All right, and when it's not at 98.6, then those homeostasis functions that I talked about earlier are going to try to bring it back to that temperature. So it's going to cause the body to do things like sweat or shiver to try to help maintain this temperature. And of course, that shivering depends on your age, right? Because if you're a newborn, you're not going to shiver. You depend on brown fat. So again, age, health status, all those things can play a part in this. So we assess the body temperature routinely as a vital sign because of the fact that it needs to be within a certain temperature. When it's not, it's going to cause other things to happen within that body. Sexuality is also a very important component of each person, and it can be affected by both physical and emotional problems. Okay, the practice of sex depends on a lot of different factors, like a person's age, their socio-cultural background, their self-esteem, and their level of health. So, as healthcare providers, we have to be aware and we have to consider that sexuality is a vital part of holistic care. And you'll hear me talk about this a lot because it does play a lot in the fact of how people determine how well that they are functioning as a person. Okay, this is one thing that people have to have in their life. Just like they have to have rest, just like they have to have food, they have to have this sexuality in order to function. Physical activity and rest depend on how intact or how well our neuromuscular and skeletal systems are functioning. We need rest or sleep. This allows time for the body to rejuvenate and be free from stress. Okay, requirements for rest and sleep vary widely. If you're a nurse, your sleep might only be 4 hours a day, right? Just kidding. Uh, but yeah, it can vary widely. So when you look at the developmental stages as we're going through, like an infant, infants, they sleep a lot, right? They sleep, pretty much sleep throughout the day. They'll wake up for periods of time, a couple hours here and there, and they'll eat and poop and go back to sleep. And then they become toddlers and preschoolers, and they need less sleep. They become school age kids, and what are we usually giving them? 8 to 9 hours a day of sleep. Okay, and then you go into adulthood, and so everybody's pattern is going to be different. Some people need a lot of sleep. Okay, my partner sleeps like 12, 15 hours a day if she could. Okay, I'll sleep more like 3 hours a day. So everybody's needs are different. I probably should rest more, but that's the way my body functions. All right, so other factors that can influence sleep are age, environment, exercise, stress, and drug use. And by the way, the drugs don't work. I try the melatonin, I try the other one that's addictive, the Ambien, and they just don't work for me. Safety and security is our next topic. Second in priority after physiological needs. Um, it also has physical and emotional components. So, physical safety and security means that we protect our patients and our family members from potential or actual harm. And we do a lot of things as a nurse in order to meet that patient's physical safety needs. Like, we have to do things like using proper hand hygiene, making sure the electrical equipment isn't broken or damaged or at risk for causing a shock or damage to someone. Administering medications not only knowledgeably but safety and without error. Skillfully moving and ambulating the patients, and then teaching parents about things that are dangerous to their kids, particularly household chemicals like poisons. Priority need is called often a higher level need. Okay, this is a love and belonging need, and it's related to understanding and acceptance of others in both giving and receiving of love. The feeling of belonging to a group, such as a family, peer, friend, neighborhood, or a community. People who believe that their love and belonging needs are unmet often feel lonely or isolated and may withdraw physically and emotionally, or they can become demanding and critical. These behaviors will signal that the person has unmet love and belonging needs. Nurses should always consider love and belonging needs when you're developing your plan of care. Okay, and also you want to include nursing interventions such as including family and friends in the care of the patient, establishing a nurse patient relationship based on mutual understanding and trust. And you do this through demonstration of care, encouragement of communication, and respecting the patient's privacy. Refer the patient to a specific support group like a cancer group or a Alcoholics Anonymous, according to what fits or what is needed. Next is self-esteem needs. Okay, this is the need for someone to feel good about themselves. Pride, a sense of accomplishment. They want to believe that others respect and appreciate those accomplishments. Okay, so, how can this be beneficial to you? Well, you want to encourage your patients and you want to give them pats on the back when they meet those goals or when they partially meet those goals to know that they're doing great. Who else can you do this with? As a charge nurse, you could do this with the people that work under you. It could be the housekeeper, a nurse's aide, anybody, okay, that works under you. You want to let them know when they've made an accomplishment, or just let them know that you appreciate them and you respect them. And it's not just telling them, you have to show them through your actions that you respect them. Treat everyone the same. Don't isolate or treat someone different from someone else. Be fair and equitable across the board. um, we want to promote a positive self esteem. That helps the person to build confidence and it will help them become more independent. And also, when we allow people to do things for themselves, we don't do everything for them. We allow them to do the things that they can for themselves. That also will help promote self esteem and build their confidence and also encourage them to become more independent. This is one of the things that we have to talk about because when someone comes into the hospital or comes into our facility and they're not going to be there for the long term, I mean, even when they are there for long term, we're going to do this. But in specific, I'm talking about patients that go to like rehab for a short period of time, like after they've had a heart attack or something like that. Our thing is that we want to get them back to their previous level of functioning or as close to that as we can. So we're trying to promote as much independence as we can because these people are going to want to go back into the home. They're going to want to live on their own. Okay, and that's why they get scared when they fall or when they do something they're not supposed to, and they don't want to report it because they're afraid that you're going to take their independence from them. All right, so how can their self esteem be affected? Well, we talked about this a little bit before on some of the other videos, role changes, okay? And we'll talk about this when we do the care plan. How is that role change affected? So let's say I'm a father and I'm supporting, my wife and my 4 kids, and my wife doesn't work because she's either a homeschool mom or she just stays home with the kids, and we don't maybe need her to work. Okay, so maybe she's always decided to take that role to stay home and raise the kids and do the things for the household. But now I find myself in a situation where maybe I have to have a cabbage, okay, and maybe it's a quadruple bypass. So now what's going to happen to me? I'm going to be out of work, okay, and I'm probably going to be out of work at least in upwards of 6 to 8 weeks. And then a lot of things are going to depend on whether I can even go back to that role of what I was doing before. And on top of that, do I have another role that I can now do if I'm not able to work in that role anymore? So now I'm thinking, as the man, how am I going to support my family? My wife has no experience in the workforce. She maybe has no education other than a high school education. So I have to think about what level of entry she's going to go in. Is that level of entry going to be able to support our family if she does have to go back into the workforce? Okay. And it's taking away from me as a man. Like, now I can't be a real man. I can't support my family. I can't do the things I'm supposed to do that I set myself up for in life to do. Okay, so that's going to put a lot of stress and change a lot of dynamics in that department. And then also body images, okay, and these can be all types of different body images. um, a person that has anorexia, they perceive themselves as being fat, right? They look in the mirror, no matter how skinny they are, they look at themselves as being fat. So other people, if I'm burned, I may have scars. If I have some sort of surgery, like a hysterectomy or something, that might give me scars. If I have open chest surgery, that might give me scars. So how am I going to feel about that? Also, I may look weaker and more depleted because my health status isn't what it normally is. Okay, so all these things can actually play off of one another and really hit me right in that self-esteem pocket. Our highest level of hierarchy is our self-actualization needs. And this is being able to reach our full or maximum potential. And we do this through our own unique characteristics or traits or goals, okay, how we set ourselves up. And in general, we have to meet those lower needs first before we can actually meet this need. In order to meet this need, some things that we have to be able to do is accept ourselves. We have to recognize ourselves, our own weaknesses and strengths, our own biases, okay, and others. And we have to be able to accept other people as they are, okay, because the first thing people do when they meet or see other people, they want to do is change them. All right, if you accept me as I am, then you don't want to change me. The focus of interest on problems should be not on yourself, but the problems outside yourself. You should be able to be objective. You should be happy and affectionate towards others, okay? And you should be happy for them, as happy as you are for yourself, not jealous or angry. You should have the ability to discriminate between good and evil, okay? So you're knowing the difference between right and wrong. Creativity as a guideline for solving problems and pursuing interests. So in order for us to help meet our patients' self-actualization needs, then we focus on that person's strengths and possibilities and not their problems. That's exactly what that means. Okay. So an example of this is a diabetic patient comes in and tells you that they're having a problem with their dietary recommendations. They understand that they have to be more careful because if they don't, it's going to have consequences like causing them diabetic retinopathy or causing them maybe to lose a limb or something behind amputation. Okay, but they're having difficulty doing that. Okay, so you have to come up with a plan to help them achieve that goal. And it might have to be baby steps. Okay, you can't expect people to take these big jumps, these unrealistic goals. You got to take them down the road in little baby steps. Okay, so this is why we have short-term and long-term goals. So you're going to do those short-term goals, things that we can help them obtain and build their confidence and build their sense of independence and get them back to that previous level of functioning. And then those goals and those interventions should also be catered towards whatever that primary nursing diagnosis is. So if I'm having difficulty breathing, okay, those interventions should be aimed at things that are going to help me to breathe better and things that I could do independently to help myself. So, nursing interventions that you will do as the nurse, and then what will you give to your patient to do that they can do independently to help them meet this objective? Maslow's hierarchy of basic needs in our ADPI, right? Our assessment, planning, implementation, diagnosis, and evaluation of patient care. All right. Diagnosis will come along once we do these other things. This hierarchy can be used with any patient at any age and in any setting. And it helps with both health and illness. It also helps us as the nurse identify needs that have not been met by the patient. And will identify that because they're going to become healthcare needs for that patient. Remember, when they don't fulfill those needs, it results in some sort of illness. So we're going to see that when they come in to see us, okay? The hierarchy or the way that it grows, the way that the chart goes from most important to least important, or from the lowest level to the highest level, okay, helps us determine where the patient is on health versus illness. Okay, and it helps us incorporate the things that we need to in the health models so that we can meet those patient needs. We are able to identify and carry out interventions by prioritizing those needs and recognizing those needs. We're able to meet those actual needs, those potential needs. Okay, and remember that each person is unique and they set their own priority for need. Okay, the needs of the human are interrelated, so they may require more than one level of nursing action. So, for example, if you're taking care of someone that's coming into the hospital with a heart attack, your first concern is going to be oxygen and pain relief, but at the same time, you have to think about safety to make sure they don't fall. You also have to think about if they have a family member nearby, so that's your love and belonging needs. You might need that family member for a variety of things. So, again, we're meeting all these needs and we're doing it, we're prioritizing it, but they're going to be interrelated. And at some point, you might be going from one and into the other at the same sort of time. Patient need has the highest priority. A patient who needs to ambulate to prevent a DVT, a patient who is isolated and feels lonely, a patient who recently lost her husband, or an elderly patient who is at risk for falls. So, again, you're thinking about which one of those categories of Maslow does each one of these statements represent, and that will help you to answer this question. You said the patient with the DVT. Okay, it's a physiological need. It has the highest priority. Isolation, having unmet love and belonging needs would be third priority. And a patient who lost a spouse might have unmet self-esteem needs, and that would be fourth in priority. A patient at risk for falls would have unmet safety and security need risks, and that would be second in priority. So next we're talking about family structures and how these family structures, what are the definitions of them, okay? So family includes any group of people that live together and depend on one another for physical, emotional, and financial support. And remember, it doesn't say anything in there about them being related to each other, okay? Nuclear family is that traditional family, two parents and their kids. The extended family would include auntie, uncle, and grandparents. And a blended family would be two parents and their unrelated children from previous relationships. So the Brady Bunch. All right. Parent, a single parent family is one where the parents are separated, divorced, widowed, or they did not remarry. So it's just them and the kids, and there's no other spouse involved. Family functions can occur in five major areas. The family helps provide safe, comfortable environments. They are needed for growth and development, rest and recuperation. Economically, okay, our family provides financial aid to our family members and it helps meet the needs of society. The family can help reproduce, okay, so we're reproducing, we're raising children. The family can help with effective and coping. So, effective, remember, it falls under that emotional capacity, okay? So, this is a psychosocial component. They're helping me to cope and deal with my stress. All right, socialization. This includes things like where the family teaches us or helps us to believe in certain values and attitudes, provides us with certain coping mechanisms. They help us provide feedback and they help us to problem solve. Of the family. So we have the couple in the family with children. They're in that family planning stage and they're married. We have the family who has the adolescents or the young adults. Okay. We're teaching values. We're teaching them about communication. We're talking to them about marriage options. We have the family with the middle-aged adults. And this is where we're bridging those generation gaps and preparing for retirement. And then we have the family with older adults where they're dealing with things like retirement or loss of a spouse. And a lot of friends usually too, also with this. When we talk about the family, we look at different things like what kind of lifestyle risk factors are there. Okay, this could be things about eating, drinking, the way we live, what kind of risks that we take when we're out there, just in the general world, like riding a bike without a helmet or eating a lot of fried fatty foods. Okay, psychosocial risk factors. So, what kind of things, put our family at risk? Okay, if we're not meeting, first of all, those basic physiological needs and those love and security needs. Okay, um, environmental. All right, how does the environment affect the way that we function as a family? Okay, and then developmental risk factors, which we're going to talk about in a minute, which talks about the different tasks of the family, and then biological risks, which would be things in the environment, like chemically, that could affect us, or even genetics. Factors that could affect our health is not having a proper social support system in place, not having access to community health care, not having the economic resources like health insurance or access to get to that health care, transportation, things like that, and then other environmental factors, and that could be things that are in the water, things that are in the air, and things that are just in the home environment as well, or the community. So, physically, the family provides us with a safe, comfortable environment that's necessary for growth and development and rest. Economically, the family provides financial aid to family members and helps meet society needs. Reproductive, many families want to raise and have children. The effective and coping functions of the family help provide emotional support, to family members and help members establish identity and maintain it in times of stress. And then finally, through socialization, the family teaches, transmits beliefs, values, attitudes, and coping mechanisms, and helps provide feedback to guide problem solving. So, we are a member of a community. Characteristics of the community influence on the health of a member. So, those prevailing values and beliefs of the community, available educational and recreation programs, healthcare resources, being able to provide services and goods, access and transportation and communication facilities, protection, safety, and anesthetic concerns. Want to meet our basic human needs, it's essential to health and survival of all people. Maslow developed this hierarchy of basic needs. Physiological needs must be minimally met to include oxygen, water, food, elimination, temperature, sexuality, physical activity, and rest. Safety and security needs are the next priority, which involve both physical and emotional components. Love and belonging needs include the understanding and the acceptance of others in both giving and receiving love, as well as the feeling of belonging to a family, peer, friend, a neighborhood, and a community. Duvall developed critical family developmental tasks and stages in the family based on Erikson's theory of psychosocial development. And it says that all families have certain basic tasks for survival and continuity, as well as specific tasks related to developmental stages throughout the life of the family. You'll find the stages and developmental tasks in table 4-2 in your book. If the family is not able to meet these certain developmental tasks, or if society disapproves, it could be intervened, or there could be some intervention by child services, social services, welfare, and so on. To master each developmental stage, it depends on the family's ability to adapt and grow through the previous stages. People learn how to engage in different healthcare activities, health beliefs, and values. Okay, when patients enter the healthcare system, they bring their own personal behaviors and needs, but they also bring in a sense of their family too. Excuse me. Identified how important it is for family-centered nursing care to occur. The family is composed of interdependent members who affect each other. And when illness occurs in one member, all the family members usually become involved in the illness. Also, because there's a strong relationship between the family and their health status, or each member's health status, the family is essential in every level of nursing care. The level of the family's health turns each member um, to look towards improving health promotion activities. And then illness of one family member may suggest the possibility of the same problem in other members of the family. So through assessment and intervention, we can help improve the health status of all the family members. We need to understand that, okay, illness is going to precipitate a health crisis in the family. If an illness is minor, changes in the family tasks may be minor. But if a family's member injury or illness is serious, roles, responsibilities, and functions of other family members change. And we talked about this. Like if someone has, if they're the main primary sole caregiver and they were to have a heart attack. This is especially true if the illness is chronic or long-term or causes some sort of disability or decreases the person's time to live. Sometimes families find it difficult to adapt to this change, okay? They become very stressed out with the financial, social, and caregiving responsibilities and resources. Other families experience a renewed family closeness and stability. So regardless of how the family adapts, each member of the family must consistently adjust to the role and the responsibilities and manage those needs of not only themselves, but that ill family member. Include the need for a person to feel good about themselves, to feel pride and a sense of accomplishments, and believe that others also respect and appreciate those accomplishments. Self-actualization needs are the highest level of hierarchy and include the need for individuals to reach their full potential through development of their unique capabilities. A family is a group of people who live together and depend on each other for physical, emotional, and financial support. Family structures include the nuclear family, the single-parent family, and other non-traditional family structures. Patterns of behavior for the family, the environment in which the family lives, and genetic factors all put family members at risk for a health problem. A community is a population or a group of people that live in the same geographic area under similar regulations and having common values, interests, and needs. Nurse managed centers in the community offer high quality care to the underserved population in a cost effective way. 5 family functions that are viewed as essential to growth. Okay, the first one is management. This involves using power and decision making regarding resources, establishing rules, providing finances, and planning for the future. These responsibilities are generally assumed by the adults of the family. The second function of the family is to set boundaries, make distinctions between the generations and the roles of the adults versus the children within the family structure. The third function, communication, is extremely important to individual and family growth. A healthy family will have a full range of clear, direct, and meaningful communication among their members. The fourth function is education and support. Education usually involves modeling skills for living in a physically, emotional, and socially healthy life. Support is manifested by those actions that tell the family member, hey, we care about you and we love you. And it helps promote health, and it's seen as a critical factor when we cope with health crises and illness. The fifth function is socialization, and this involves helping the family transmit culture and accepting behaviors that are needed to perform adequately in both the house and in the world. Maslow's hierarchy of basic human needs to direct care for a patient on an intensive care unit, for which nursing activity is this approach most useful. A. Making accurate nursing diagnoses. B. Establishing priorities of care. C. Communicating concerns more concisely. Or D. Integrating science into nursing care. Establishing priorities of care, that is correct. We use Maslow's hierarchy of basic needs to establish priorities of care. Remember, we have to meet those physiological needs first, followed by safety and security, love and belonging, self-esteem, and then self-actualization. Prioritizing nursing care for a patient in a long-term care facility. Which examples of nursing interventions help us meet physiological needs? Select all that apply. Preventing falls in the facility, changing a patient's oxygen tank, providing materials for a patient who likes to draw, helping a patient eat his dinner, facilitating a visit from a spouse, referring a patient to a cancer support group. There's a lot of answers here, Miss Sue. How am I going to answer this? Okay. Select all that apply or simply true or false statements. So it's asking about physiological needs. You already know that the basic physiological needs of Maslow are what? Oxygenation, food, water, temperature, elimination, okay? Rest. So, read the statement. Does that statement fall under one of those categories? Okay? So, the following example is a physiological need. Preventing a fall in the facility. Is that true or false? That's false, right? Because preventing a fall falls under what? Safety and security. Changing a patient's oxygen tank falls under the physiological needs. True or false? That's true, right? Oxygen is our primary need, so that's definitely going to fall under there. How about providing materials for a patient who likes to draw? All right, this might fall under self-esteem or self-actualization, okay, but it doesn't fall under physiological needs. How about helping a patient eat his dinner? Helping a patient eat his dinner falls under the physiological needs of Maslow's hierarchy. Does it? Yes, because it's eating, drinking, elimination. That falls under uh, the physiological needs. How about facilitating a visit from a spouse or a family member? Okay, facilitating a visit from a spouse or a family member falls under the physiological needs. We know that's false, right? That falls under love and belonging. All right, how about referring a patient to a cancer support group? Again, that's not a physiological need, so that would be false. We're changing the patient's oxygen tank. That meets those oxygenation needs. And we're helping the patient to eat his dinner. That meets those elimination needs. Again, physiological needs, oxygen, water, food, elimination, temperature, sexuality, physical activity, and rest have to at least be met minimally in order to sustain life. Providing food and oxygen are examples of those interventions. Falls meets safety and security. Art supplies may meet self-actualization needs. Facilitating visits from a loved one may help meet self-esteem needs, and referring a patient to a support group helps meet the love and belonging needs. Patients post-op use careful hand hygiene and sterile techniques when handling a patient. Which of Maslow's basic human needs is being met by this nurse? Carrying out careful hand hygiene and using sterile technique, nurses provide safety from infection. Caring for a patient in a long-term care facility uses available resources to help the patient achieve Maslow's hierarchy highest level of needs. Self-actualization, which statement accurately describes these needs? So again, these are true false statements. Humans are born with a fully developed sense of actualization. Self-actualization, is that true or false? Okay. Self-actualization needs are met by depending on others for help. The self-actualization process continues through life. True or false? Loneliness and isolation occur when self-actualization needs are unmet. True or false? A person achieves self-actualization by focusing on problems outside themselves. True or false? Self-actualization needs may be met by creatively solving problems. True or false? No, you should have said that the self-actualization process continues throughout life. That's true. A person does achieve self-actualization by focusing on problems outside of themselves. That's true. And self-actualization needs may be met by creatively solving problems. All right, self-actualization or reaching out to your full potential is a problem that occurs throughout life. You achieve self-actualization by focusing on problems outside of yourself and using creativity as a guideline to help solve problems and pursue interests. Humans are not born with a sense of self-actualization, and self-actualization needs are not met specifically by depending on others. Loneliness and isolation are not always the result of unmet self-actualization needs. A nurse works with families in crisis at a community mental health care facility. What is the best broad definition of family? A. A mother and a father and children. B. A group whose members are biologically related. C. A unit that includes aunts, uncles, and cousins. And D. A group of people who live together and depend on each other for support. That's your best choice. Although all the responses can be true, the best definition is a group of people who live together and depend on each other for physical, emotional, or financial support. A nurse performs an assessment of family consisting of a single mother, a grandmother, and 2 children. Which interview questions directed to the single mother could the nurse use to assess the effective and coping family functions? Select all that apply. Who is the person you depend on for emotional support? True or false? That can be used to determine the effective and coping family function. Who is the breadwinner in your family? Do you have plans on having any more children? Who keeps your family together in times of stress? What family traditions did you pass on to your children? And do you live in an environment that you consider safe? All right, so you should have selected who is the person you depend on for emotional support and who keeps your family together in times of stress. Major areas of family function are physical, economic, reproductive, affective, and coping, also socialization. Asking who helps provide emotional support in times of stress and assessing the effective and coping function. Assessing the breadwinner focuses on economic. Inquiring about having more children talks about reproductive. Asking about family traditions assesses the socialization function. And checking the environment assesses the physical function. Caring for families in a free healthcare clinic identifies psychosocial risk factors for altered family health. Which example describes one of these risk factors? 1. The family does not have dental care insurance or resources to pay for it. 2. Both parents work and leave a 12-year-old child to care for his younger brother. 3. Both parents and their children are considerably overweight. Or 4. The youngest member of the family has cerebral palsy and needs assistance from the community service. So this is saying which one of these identifies psychosocial risk factors. So if you selected B, both parents work and leave the 12-year-old child to care for his younger brother, you would have been correct. Inadequate child care resources is a psychosocial risk factor. Not having access to dental care and obese family members are lifestyle risk factors. Having an obese family member is also a lifestyle risk factor. Having a family member with a birth defect is a biological risk factor. Nurse working in an aging in-place facility interviews a married couple in their late 70s. Based on Duvall's developmental task of family, which developmental task would the nurse assess for this couple? A. Maintenance of a supportive home base. B. Strength of the marital relationship. C. Ability to cope with loss of energy and privacy. And D. Adjustment to retirement years. C is the correct choice. A healthy community offers access to healthcare services to treat illness and promote health. A healthy community does not usually meet all the needs of its residents, but should be able to help with health issues like nutrition, education, recreation, safety, and zoning regulations to separate residential sections from industrial ones. The age of housing is irrelevant as long as residents maintain properly according to the code. A nurse is practicing community-based nursing in a mobile health clinic. What typically is the central focus of this type of nursing care? A. Individual and family health care needs. B. Populations within the community. C. Local healthcare facilities. Or D. Families in crisis. Hopefully you selected A, individual and family health care needs. In contrast to community health nursing, which focuses on the population within the community, a community-based nursing is centered on individual and family health care needs. Community-based nurses help families in crisis and work in healthcare facilities, but these are not the focus of community-based nursing. Child arrives at the emergency department of a local hospital with difficulty breathing from an asthmatic attack. What is the priority nursing intervention? A. Give the child a favorite stuffed animal to hold. B. Assess respirations and administer oxygen. C. Raise the side rails and restrain the child's arms. Or D. Ask the mother about the child's favorite foods. Need for a child having respiratory difficulty is oxygen. So the answer should have been assessing respirations and administering oxygen. The nurse's immediate intervention should be to meet physiological oxygen needs by assessing the respiration and administering the oxygen. Oxygen needs are more basic than our needs for food safety, such as raising the rails, or security, such as giving the child a stuffed animal to hold. During the patient assessment, the client shares that the family attends church nearly every Sunday. What function of the family does this represent? A. Socialization. B. Reproductive. C. Economic. Or D. Physical. Socialization, you're correct. The family transmits values, beliefs, including those of religion, through socialization. The family provides financial aid to family members, fulfilling the economic function. The family can meet the physical needs, providing a safe and comfortable environment that is essential for growth, development, and rest and recuperation. Reproductive function of the family is to have children. Conducting a home assessment and suggests that the client's family remove scatter rugs from the home and increase the lighting. Which basic human need is being addressed by the nurse's suggestion? A. Physiologic, B. Self-actualization, C. Safety and security, or D. Self-esteem. Security, making changes in the home environment, such as removing rugs and increasing lighting, promotes safety of the family member. Physiological needs include those that meet basic body functions like oxygen, water, and food. Self-esteem needs include need for an individual to feel good about themselves or feel pride or a sense of accomplishment and to believe that others respect and appreciate those accomplishments. And self-actualization includes the needs for individuals to reach their full potential through the development of their unique. A couple recently married. Both the husband and the wife have previously been married and had 2 children. What name is given to this type of family? Remember the Brady Bunch. Blended family is one that is formed when the parents bring unrelated children from previous relationships together to form a new family. An extended family includes relatives. A nuclear family is the traditional mother, father, child. A cohabiting family is composed of members who live together but are not married. The nurse is caring for a child admitted after an automobile accident and recognizes the importance of including the family in the plan of care. Including the family meets which of Maslow's basic human needs? A. Love and belonging, B. Physiologic, C. Self-esteem, or D. Self-actualization. Belonging needs include understanding and acceptance of others in giving and receiving love and feeling of belonging to family, peers, friends, neighborhood, and a community, including family and friends in the care of a client of a nursing intervention to meet this need. Physiological needs are met by medications and vital signs. Self-esteem is promoting the self-worth of the individual and focusing on what the client exhibits that is positive. And self-actualization is the client's realization or fulfillment of the person's talent and potential. For a client, the nurse recognizes which as the primary educational and support structure for an individual. Family is the primary educational and support structure for an individual. The family as a social unit provides the environment and relationships necessary for members to meet their basic human needs. The family structure of the client and determines it is an extended family. Which family represents an extended family? 2 parents, 3 children, and 1 grandparent. A man and a woman who are married with each child from a previous marriage. B. C. A man and a woman who are not married. Or D. 2 parents and their children. Family includes aunts, uncles, grandparents who live in close geographic proximity to one another. A traditional family consists of 2 parents and their children, and a blended family is that Brady Bunch, when parents bring their unrelated children from previous relations together to form that new family. Individuals that choose to live together for a variety of reasons form a cohabitat. Used for performing a basic family assessment. A. Interview. B. Physical assessment. C. Survey. And D. Poll. An interview for the basic family assessment. Physical assessment is used for individual assessment, and surveys and polls help assess the community. Speaking client is admitted to the emergency department with a urinary tract infection and is experiencing a stress response from hospitalization. What is the priority nursing intervention? A. Begin taking client history. B. Contact a translator. C. Collect a urine specimen. Or D. Administer a broad spectrum antibiotic. Contact a translator. In order to decrease the patient's stress, We have to provide explanations that the patient can understand in a language they can understand. So we must contact a translator to help facilitate communication. This is our priority nursing intervention. Yes, we are going to take a history, we are going to collect urine, and we are going to start antibiotics, but they are not emergent. Effective communication takes precedence, especially when a stress response is present. The nurse in the adolescent's inpatient psychiatric unit is interviewing the patient of a 16-year-old client admitted for depression and threatened suicide. What assessment information is most essential for the nurse in determining the effective and cope functioning of the family? A. Responsibilities of the adolescent. B. Employment history of the parents. C. Family patterns of communication. And D. Environmental hazards in the home. So this is asking us what assessment information is most essential for the nurse in determining the effective and coping function of the family. So here we're talking about the emotional and coping response patterns, okay? The five major areas of family function are physical, economic, reproductive, affective, coping, and socialization. When we're assessing the family of a depressed client for effect and coping function, it's helpful for the nurse to be aware of the family's communication style. This information can help identify family difficulties and teaching points that could benefit the client and the family. A home health nurse is visiting a family after the recent death of their matriarch. The nurse observes that the family is dressed in black. All of the mirrors are covered, and the immediate family is sitting on a wooden box instead of a chair. The nurse asks what is happening and is told, "We are Jewish, and the family is sitting in Shiva." The family is fulfilling which family function? Okay, the family is fulfilling which function? Economical function, physical function, affective and coping functions, or socialization function? Said effective and coping functions, you would have been correct. This family is showing the function of effective and coping by observing the ritual of sitting Shiva, by observing this Jewish 7-day period of mourning for first degree relatives, husband, wife, parent, or child. The family provides emotional comfort to other family members to help establish their identity and maintain it in times of stress. Economical function provide financial aid. Physical function provides safe, comfortable environmental um, support necessary for growth and development. Through socialization, the family teaches values, attitudes, and provides feedback with the function of reproduction, and the family produces and raises children. Regarding Friedman's theory of family-centered nursing care. The role of the family is essential in every level of nursing practice. The family is composed of independent members who live and function individually. The focus on health should be directed at improving the health of the sickest member of the family. Illness is one of the family member's strengths, the roles of the sick member in the family structure. The role of family is essential at every level of nursing care or practice. You're correct. Friedman identified the importance of family-centered nursing care based on four rationales. First, if the family is composed of interdependent members who affect one another, if some sort of illness occurs in one member, all members become part of the illness. Second, a strong relationship exists between the family and the health status of its members. Therefore, the role of the family is essential at every level of nursing care. The third rationale is at the level of health of the family, and in turn, each member can be significantly improved through health promotion activities. And finally, the illness of one family member may suggest the possibility of the same problem in other members. Thorough assessment and intervention by the nurse can help improve the health status of all members. A client states, "I have successfully raised my family and had a good life." This statement illustrates meeting which basic human need? A. Safety and security. B. Love and belonging. C. Self-esteem. Or D. Self-actualization. You said self-actualization. You're correct. The highest level on the hierarchy of basic needs is the need for self-actualization. which includes accepting oneself and others, reaching one's full potential, feelings of happiness and affection for others. Safety needs in Maslow refer to the need for security and protection. Love and belonging needs include need for interpersonal relationships, and self-esteem needs include need for confidence, self-esteem, achievement, and respect. A nurse is caring for an adolescent who lost a leg in a motor vehicle accident. Which human need would the nurse most likely need to address? A. Love and belonging needs. B. Safety and security needs. C. Self-actualization needs. Or D. Self-esteem needs. Esteem needs, you are correct. The adolescent would have issues and concerns in the self-esteem area. Self-esteem needs would include fear, sadness, loneliness, and accepting self. Love and belonging would focus on the socio-cultural aspect and include relationships with others, communication with others, support systems, being part of the community, and feeling loved by others. Safety and security focuses on the environmental aspect and would include things like housing and community and the neighborhood. Self-actualization needs are in intellectual and spiritual dimension and would include areas such as thinking, learning, decision-making, values, beliefs, and helping others.